Let's begin by looking at the learning objectives. In these learning objectives, we are going to describe the types of intrauterine device. We are going to describe the efficacy of intrauterine contraceptive device. We're going to discuss the mechanism of actions, the advantages and disadvantages. We're also going to look at some common misconceptions attributed to intrauterine contraceptive device. We're going to identify clients who are eligible for intrauterine contraceptive device and state the steps of intrauterine contraceptive device insertion and removal. By introduction, the copper IUD contains copper T380A, is widely available and well known for its effectiveness, wide margin of safety and low cost. It also has 99% effective contraceptive for many women globally. Good choice for women who cannot or chose not to use hormone-releasing contraception. Also, the copper T380A is a T-shaped flexible device with a polythene with barium sulfate, 314 millimeter of copper wire wound around the vertical stem. Each of the two arms of the T has a sleeve of copper which is measuring approximately 33 millimeter, and the protection period is for 12 years. Let's look at an overview of the copper T380A. Like you are seeing on the screen, you can see we have the copper itself. The copper T itself is shaped like a T, and when you look closely, you will see the sleeves. The copper sleeves, which I have already explained, is measuring approximately 33 millimeter times 2, that is 66 millimeter cubed. And it also have the arms at the right and the left side of each part of it. And of course, you see the stem and the string lying low below. The copper wire is about 314 millimeter cubed, like I explained previously. Presently, we have two main types of intrauterine contraceptive device. The first one is the copper containing intrauterine contraceptive device, which is also known as the Paragard. And we also have the hormone containing, which is known as the Mirena. For the Mirena, it contains progestogen, which contains progesterone, like the one that is in the body. The duration and efficacy of intrauterine contraceptive device depends on the type. If it is the copper IUD, the copper T IUD, it's copper T IUD, which contains 380A. The duration is about 12 years. And also the efficacy also depends on the type of user. We have the typical users and we have the perfect user. For the typical users are those ones that sometimes when they are using this method, they may change to other methods. But for the efficacy for those ones who are not consistent, it may be around 0.8%. But for those ones who are perfect users and they are consistent in the usage, the efficacy is around 0.6%. For the Mirena, like I explained previously, the one that contains the progesterone, the duration is 5 years, and also the efficacy depends on the users also. For the typical users, it's about 0.2%, and for the perfect users, it's about the efficacy rate is about 0.1%. Now let's look at the mechanism of action of intrauterine contraceptive devices. One of the important mechanism of action is it inhibits fertilization by causing chemical changes. You see, sometimes people used to say that intrauterine contraceptive device may be a kind of an abortifacient. It's not true, because what it does is that when the spermatozoa is released, it will prevent the spermatozoa from fertilizing the ova by releasing a chemical, by causing a chemical change on the lumen of the fallopian tube. It also interferes with the ability of sperm to pass through the uterine cavity, and of course inhibits ovum transport. So because of the release of the chemical substance, it acts on the lumen of the fallopian tubes, changing the consistency and the composition of the secretions in the fallopian tube. So that will lead to, or it will inhibit further movement of the ova. When the uterus is exposed to a foreign body, a sterile inflammatory reaction occurs. Like we all know, you can see that because of the release of those chemical substances, which is a foreign body, it will lead to inflammatory reaction, which will prevent or inhibit further progression of the sperm to fertilize the ovum. And then, of course, that will form like a toxic substance to the sperm and the ovum, thereby impairing implantation. The benefits of copper IUDs, there are many, but we're going to mention some of them in this presentation. One of them is that it is highly effective, more than 99%, like I talked about in the introduction. Long-term method of contraception for up to 12 years. It does not require ongoing efforts for the partners. Effective immediately after insertion, and of course it is cost effective, and also fast return to fertility. It do not affect breastfeeding or does not interfere with breastfeeding. Not user/partner dependent. This means that the partner, they don't need to all the time check if for the strings. Once it is put properly in place, then it is not user or partner dependent. It can be used as emergency contraception within the first 5 days following exposure to unprotected sexual intercourse. Lack of hormonal exposure, like I said, it's just the release of chemicals that will lead to chemical reactions that may lead to inflammatory process, preventing the sperm and the ovum from fertilization. Continued regular menstrual cycle, it does not interfere with the menstrual cycle. The menstrual cycle is normal as usual. And of course, some research has also proven that it can also protect against endometrial cancer. Of course, there's nothing that does not come with its own disadvantages or shortcomings. It has its own shortcomings. One of the shortcomings for copper IUDs is no protection against genital tract infections. Example like HIV. Slight increase in average monthly blood loss in the first 3 to 6 months. Psychological discomfort of foreign body inside. The person may be feeling that something is inside my body, so the person may have some psychological discomfort. And of course, trained provider dependent, because if there is any problem, the person has to go back to the hospital and then has to meet the trainers or the provider in order to ascertain the problem. It has some rare complications, like sometimes there is missing strings or expulsion of the intrauterine contraceptive device. Sometimes also there might be occurrence of pregnancy, especially when it is not properly inserted, and such pregnancies we may have intrauterine or ectopic pregnancy. Perforation, if the person that is inserting the IUD is not trained or skilled enough, then the person may extend, and then it may lead to perforation, but the perforation is less than 1 in 1,000 cases. Pelvic inflammatory diseases with or without tubal ovarian abscesses may also be some of the real complications. Also, we have some myths and misperceptions about the copper IUDs. One of the myths or misperceptions may include infertility. Some people believe that when they are using the IUCD, that in future they may have infertility. Some people believe that it may lead to infection or to ectopic pregnancy. And then some people also believe that when they are using the intrauterine contraceptive device, it may also lead to pain. or it may lead to abortion. There are some people that believe that it is a form of abortifacients, but it is not true, because like I previously explained, that when the intrauterine contraceptive device is inserted, what it does is that it prevents the sperm and the ovum to come together through the process of inflammatory process that releases chemical that changes the chemical constituents of the cervical secretion and the fallopian tube secretion. So the lining of the fallopian tube is no longer as smooth as it's supposed to be. So because of the reaction of the chemicals within the lumen of the fallopian tube, that will lead to inflammatory process, and that will prevent the fertilization process to take place. And again, in some cultures or in some places, they also believe that it may appear even in reincarnation. Let's talk about reincarnation a little bit. For reincarnation, sometimes people have different perceptions of things. They believe that if they have the intrauterine contraceptive device inserted, that when they die and come back to life again, that they will come back to life with that same intrauterine contraceptive device in situ in the uterus. I think these are some myths, and of course, from what we have seen, you can see that it's not true. Sometimes some people believe that it may lead to anemia. Yes, if following insertion, you can see that maybe if the woman have heavy bleeding, that heavy bleeding may lead to loss of iron, and the losing of the iron may predispose her to anemia. But intrauterine contraceptive device by itself does not lead to anemia. It requires restriction of physical activity. No. And that is not true, because you can't even feel it. It's not something you can feel. Maybe it's in the psychology of the person, of that individual, but the person is not supposed to feel it. Cannot be used by nulliparous or adolescents. That is not true also. Of course, even if someone is a nulliparous or an adolescent, the person can use the copper intrauterine contraceptive device. Some people also believe that sometimes it may migrate to other parts of the body, like the kidney, the heart, the brain, but that is not true, because anatomically you can see that there's a big difference between the uterus and those parts of organs of the body that those users were talking about. May increase HIV transmission to partner or pelvic inflammatory disease if used by HIV positive women. Of course, that is not true, because if before insertion, if the woman is clinically well and she's taking her antiretroviral drugs properly, then there will be no problem. But if the woman has infection already, or the patient is clinically unwell, or that patient is not taking her antiretroviral drugs as prescribed, then the person will have a high incidence of getting sexually transmitted infections. Causes birth defects. Sometimes some people also say that it causes birth defects, that when you are using intrauterine contraceptive device and the woman becomes pregnant with it, that she will deliver a baby with congenital malformation. But of course that is not true, because if the woman becomes pregnant, it may be due to poor skill of the person who inserted, the provider, but that will not lead to congenital malformation. Now let's go look at the categories of medical eligibility criteria for contraceptive use. When you see the colors, you see there are different colors in each of the categories, and I encourage the students to memorize all those colors, because those colors is what is going to help you when you have the clinical medical eligibility criteria wheel. You will be able to immediately see and know if my patient falls into which of the categories. We have category is 1, 2, 3, and 4. For category 1, we see it's in green color, and that is a condition for which there is no restriction for the use of the contraceptive method. In the category 2, where we have the light green, this is a condition for which the advantages of using the method generally outweighs the theoretical or proven risk. In category 3, this is a condition for which the theoretical or proven risk usually outweigh the advantages of using the method. And the one that we see in the red, we say that a condition that represents an unacceptable health risk if the contraceptive method is used. So those are some of the criteria and the eligibility. And it is very good that we have to look at those eligibility criteria critically and carefully, so that when you are providing those methods, you are not going to provide a method that the client is not eligible to, because if you do, that could lead to complications. Now let's go quickly and look at who can use IUDs. In category 1 and 2, any parity, a woman of any parity, any age, immediately after abortion or delivery or after cesarean section, not yet sure that permanent method may be vasectomy if it was done but they are not sure. Yes. HIV positive patients within 5 days of unprotected sexual intercourse. This means that it can also be used as an emergency contraceptive. Women who cannot use hormonal methods. We have some women, because of some health problems, they may not be able to use this the hormonal method. So they fall into this criteria. Women with previous sexually transmitted infection, unless they are currently at high risk. Those are the people that are categorized under the category 1 and 2. And then in category 3 and 4, that is who should not use intrauterine contraceptive device. We have pregnant women, known or suspected, unexplained vaginal bleeding, in postpartum between 48 hours to 4 weeks, in postpartum, post-abortion with sepsis, current PID, STIs or prolonged cervicitis, women with high risk of sexually transmitted infections. Still in category 3 and 4, women with uterine and cervical malignancies, other uterine distortions like fibroids, biconate uterus, etc. Women living with severe or advanced HIV, maybe advanced HIV, according to World Health Organization staging, stage 3 and 4. Current pelvic tuberculosis, gestational trophoblastic disease or cervical stroke endometrial cancer. In summary, in the first part of my presentation, intrauterine contraceptive devices are highly effective, long-term but reversible, very safe. It has a broad eligibility, effective emergency contraceptives. Dispelling myths is needed. Immediate postpartum and post-abortion insertion possible and favorable. The references, my references are from Family Planning, a global handbook for providers, and WHO medical eligibility criteria update for 2018. Thank you and stay blessed.